Hi.
How you going?
Yeah, good, thanks.
Good to see you back. It's
Thank
been
you.
a while.
Yeah,
So you've been given the all clear from the physio, which is great.
Yeah.
So the knee's feeling pretty good.
Hmm.
Oh, excellent. Okay, well, since it's your first session back
Yeah.
and you're recovering from your knee injury, surgery, we'll get you to warm up. The warm up will go for about 15 minutes. Generally, we just warm up for about 10, but given that we're getting back into exercise, we'll go for 15. So if you just start pedaling there, just keep it at a fairly low intensity just to start with, and as you start to warm up, we'll just increase the resistance on the bike and just make it that little bit harder. So the idea of the warm up is we just need to get your heart rate up to an exercise level. Generally, the resting heart rate sits around 40% of your maximum heart rate, but we need to get you up to about 70% of your maximum heart rate. Gets the blood flowing, gets the muscles warm, and less chance of injury. So we'll just crank it up a little bit more, so you're just working a little bit harder. How are you feeling?
Yeah, good.
How's the knee?
Yeah, good.
Yeah, nice and strong. It's probably stronger than ever now. Okay, so another minute or so and we'll get into, we've got an endurance program for you today, so that's so that you get a little bit stronger. Words on an endurance program, about half a dozen exercises we're going to put you through today.
Okay.
All right, that might do it. We might just get you to jump off there, just get your feet out of the pedals carefully there, because I don't want another injury. Okay, so first exercise we're going to do is a wall push-up. So just any wall. I mean, you can do a lot of these exercises at home, which is fantastic. So just your arms about shoulder width apart, just slightly body on a slight angle, and then we just get up on our toes and then we push ourselves in towards the wall. So we get a nice workout of the shoulders, the scapula, the trapeze, and we just get you to jump up there. Just raise onto your toes, and get a bit of a calf workout on this as well. Okay, just push forward. Yeah, push out. And this one out. I just want to feel your scapula. Yep, you've got a nice little squeeze there, which is great. Let's get you to do two more. How's the knee?
Good, thanks.
No dramas?
No dramas.
Excellent. It's a nice squeeze of the scapula again. That's good. Okay, just one more. Awesome. So in your program, we're going to write your program up to do 2 reps of 15 of each exercise. So that's what we classify as endurance exercise. We're working at a higher reps, lower intensity. Okay, so the next one we are going to do is a seated row. So I'm not sure if you've seen this, had this out for a while. It's a resistance band. Awesome, you can take them everywhere you go. Holidays, no excuse for not getting some exercise in, especially on holidays when we tend to drop our guard a little bit. You can get a little bit more tension by wrapping it around your hands. So work with it, see what you feel comfortable with. Just sort of slightly lean back and then just pull the resistant band in to your chest. Keeping the elbows nice and close to your torso. Keep your back nice and straight. Engage your abdominals, and this is good for your core, your biceps, rhomboids. So keep it nice and, yep, and just pull it back. Yep, I can feel that you've got a nice squeeze in your scapula. Yep. Just maybe pull your hands out that way. That's it. Now try. How's that feel?
Yeah.
That looks a little bit more natural now. Okay, we'll get 2 more at it. Push 2 more out. Nice and straight spine, engage the core. One last one for good luck. Excellent. Awesome. That's great. No knee problems there?
No, that's fine.
Good. Okay, so partial squat. This again is to help get a bit more strength in your knee. Now we need to be really mindful of this one, particularly on your right knee. Okay, so hold your arms out, legs shoulder width apart, and we just want to sort of imagine that we're sitting onto a chair. So you just sort of lower, sticking your butt out, and just raising. Again, keeping everything nice and tight and straight. And go down as far as you're comfortable. I don't want you to try and push through and then you've got to put pressure on the knee to get back up. So whatever you're comfortable with there, Steve. It's good for your glutes, hammies and quads. A total leg workout really. Yeah, that's good. How's the knee?
The knee's fine, thanks.
Probably wish you had a rebuilt years ago.
Yeah, should have.
Back into it. That's good. We'll get one more. That's really good. No pain.
No.
That's good. Awesome. Good technique.
Thank you.
It's as if you've never left the gym. Okay, we're going to have a single leg raise now. So single leg raise, you can just rest on the bike here. At home, you can just on a railing at home. So it's just as simple as holding one off the ground and just raising onto your toes. And this is a good calf muscle exercise, and it will help strengthen the knee as well. And then we'll squat. And the idea of this is to do 15 on each leg twice. Okay, so we'll just see if we've got the technique right there. Up on the toe. That's good. Looks good. We'll swap legs after that one. Remember to breathe. Always breathe. Sometimes we get caught up in concentration, forget to breathe. That's good. Okay, again, that's 2 sets, 15 reps each leg. Okay, so now we're going to go into glute raise. So we're just going to lay on the floor. Feet, knees just up, leg, arms down by your side, and it's just as simple as going into a raising your bottom off the floor and sucking in your glutes, your core, keeping it nice and tight, keeping your back nice and flat to the floor, no arching, keep it nice and flat and go straight up, bringing up the hips towards the ceiling. That's right, got that nice and flat to the floor, so you're engaging your core, that's right, and then just raising your butt off the ground up to a nice straight, like you're on a bridge. Yep, okay, down you go, up you go. You don't have to hold it for too long, whatever you're comfortable with. That's probably plenty of time, especially if you're going to be doing 2 sets of 15. Up you go. That's great. And then as you get stronger, you can even try it on one leg, keeping the other one straight out. But for the purpose of today, we'll just do the double, keep both feet on the floor. That's great. Awesome. Okay, we'll just roll you over onto your tummy, and we're just going to do a plank. Go up on your knees and on your elbows, and we just hold it there. Good for just about every part of the body, this one. Your abs, your everywhere, glutes, shoulders. Tend to hold these for probably about 30 seconds, and we'll just do a couple each session. We'll just get up again. Everything feel comfortable there? Nice, keep your hips nice and up. Yep. Nice straight back. How's that feel?
Good. Awesome.
Excellent. We'll get you back on the bike. Okay, so just pedal, just nice and slow. You just need to get your heart rate back down. You don't want any head spins when you head off because you're on a high. How are you feeling?
Yeah, good.
How's the knee?
Yeah.
Good?
Yeah. Glad I got it done.
And exercises, happy with those?
Yeah. No,
Anything you'd like to add or you got comfortable with?
no, it's been quite interesting to see them in their full routine.
Yeah, when you do the whole program, go through the whole program. Well, I guess your goal is you want to get back out onto the track.
Yeah.
A bit more running.
Yes, please.
Okay. Well, I think we won't get too excited. I think we'll just stick to this program we've got this program for the next eight weeks. And then I think we'll gradually build on the program and then hopefully we'll get you back out running again.
Great.
Anything else that you want to touch on?
It's all good.
Okay, well, I guess the important thing now is get plenty of water.
Yeah.
Do a little bit of static stretching.